Good evening, everyone. Welcome to AVPN's inaugural South Asia Impact Capital Festival. I'm Allie Hollowell, Chief Product Officer at AVPN, and your MC for this session. For those of you who don't know AVPN, we are a network of funders and resource providers with over 600 members across 32 markets. Our mission is to move more capital towards impact in Asia by providing social investors like yourselves opportunities to connect with key stakeholders across various sectors and markets to learn from one another and to find opportunities for action. We're also sharing highlights of the festival live on Twitter, so don't forget to share your experience with us by using the hashtag AVPN South Asia 2021 and social impact. And you can find those in the chat function as well here. Throughout this month, the festival will spotlight best practices and solutions that AVPN members are delivering across Asia, across India, Bangladesh, Nepal, and Sri Lanka. They will address issues ranging from healthcare, livelihoods, climate action, and education, which are all of particular urgencies for the subregion today. A few housekeeping announcements before we move to the program. To download any session resources, please click on the download icon in the agenda page beside the session title. To continue chatting with speakers and fellow delegates in this session, please make full use of the messaging function or the event feed in the platform. And finally, please note that this session will be recorded and you'll be able to access the recordings for 3 weeks after the festival. The festival this week focuses on healthcare. As we've all seen, the current pandemic has hit vulnerable populations the hardest and exacerbated structural inequalities in society. Besides the obvious health implications for individuals, the global pandemic has exposed the weakness of healthcare systems at large and uncovered many other systemic challenges that need to be addressed urgently. It's for this reason that AVPN puts the spotlight on healthcare in the first week of the festival. So I would now like to invite AVPN CEO, Naina Sabharwal-Batra, to share some opening remarks to kick off the festival before we get into the fireside chat with Debilitated from Rockefeller Foundation. Naina, over to you.
Thank you, Ali. Good afternoon and a warm welcome to AVPN's first month-long South Asia Impact Festival. I'm proud that despite shouldering a heavier burden of increasingly complex socio-environmental challenges, despite suffering from growing Zoom fatigue, despite the uncertainties that are to come to us in the future, with us in the same room are close to more than 800 social investors from around the world. In fact, we have more than 1,000 delegates who have registered for this Impact Festival. This is a testament to the commitment and drive towards sustainable development that we are seeing more asset owners, more investors, more corporates, more policymakers, more entrepreneurs, and much more moving capital towards impact. Correspondingly, I have also seen a greater openness to collaborate across sectors in the face of the physical isolation that all of us have been through over the past year. Philanthropists are pooling funds, corporates are sharing resources, policymakers are reaching out to the private sector, and we are seeing catalytic impact because of such meaningful collaborations. As the world's Asian social investment network, we at AVPN work with over 600 of our members to find high-impact partnerships, learn from one another, and act on high-impact, underserved opportunities. And at the end of last year, in addition to the several cross-sector partnerships we saw within the network, we ourselves have also partnered with more than 50 members to drive capital towards impact. Please allow me to give you a sense of the diversity of collaborative projects that we have worked on. You would have heard of Kellogg's, the cereal company. As an AVPN member, however, they do more than just manufacture cereal. They are trying to also address malnutrition. We are all aware that 70% of school-going children in India are undernourished. And while there are numerous efforts already in place to alleviate this problem, they are sometimes too dispersed. The Kellogg's team was eager to explore scalable solutions, but this was no easy task. However, at the AVPN conference in 2018 in Singapore, Kellogg's managed to identify people who shared the same goals as them. These were the Sesame Workshop and the Breakfast Revolution, who were also attending the conference, and they found synergies when they heard Kellogg speak of their work in India. This led to the birth of the Bright Start Partnership, a group of passionate experts with a variety of technical and financial experiences. Sesame Workshop leveraged their multimedia content hub to advocate for good nutrition, while the Breakfast Revolution proved to be the legs on the ground to bring nutritious food to hospitals, Anganwadis, and more. What makes this collaboration so inspiring is that nobody expected such a partnership to occur. It is when strong minds come together with an openness for diversity and a heart for people that strong relationships are fostered. Another inspiring collaboration that we love celebrating is around the use of AI in public health. This one is supported by the Rockefeller Foundation and the IIC Center of the University of Chicago. There is increasing pressure on public healthcare services in India due to scarce human resources and inadequate infrastructure. Technologies, especially emerging technologies, can have a transformational impact on health delivery in India. But technical experts must partner with the public sector to roll out the National Digital Health Blueprint. These partners, therefore, instituted sustainable governance structures to resolve key policy challenges in kickstarting the AI ecosystem for public health and engaged the larger ecosystem in creating suggestive policy frameworks. Furthermore, in-depth analysis of various national health programs was conducted to understand the existing AI readiness and key application areas for emerging technologies. In the past year, while we found that there was a global emphasis on immediate aid against the pandemic, these partnerships continued to center around high-growth, non-COVID-19 areas unique to Asia, including maternal and child nutrition, marine plastic pollution, the underdeveloped creative SME economies, and more. In fact, several collaboratives reflect a level of astuteness across funders and resource providers who are cautious of over-allocating resources to the pandemic at the expense of investing in systems change that is imperative to protect against future, likely much larger threats. In fact, these systemic challenges will only be solved if funders and resource providers work at the nexus of multidimensional issues. Looking forward, there are many ways we as social investors in the room today can build resilience for a better post-COVID-19 tomorrow. But they all boil down to a few key ingredients. The first is to work with government. While government revenue streams are drying up, the demand for social assistance and expanded safety nets is at its peak. However, financing social protection programs and systems should not be solely dependent on the government's budgetary expenditure. For an optimized system, governments need to be the first movers. They need to set clear, targeted national goals and send the right signals to the private sector. Mission-driven businesses, on the other hand, must continue to collaborate with other civil society organizations and public agencies to bridge the need-service gap. I will dive into this deeper in a little later, but I want to take this time to introduce today our newly launched Policy Leadership Lab in partnership with the Rockefeller Foundation. Diverging from traditional fellowship models, the 12-month India Lab program takes on a practice-based and adaptive approach that is able to efficiently navigate policymakers' existing and often rigorous agendas and schedules. Through various forms of resources and tailored opportunities, the India Lab will provide policymakers opportunities to foster the right partnerships, access social investments, and be equipped with best practices and knowledge through mentorship and networking. You can find more about our Policy Leadership Lab on the AVPN website, www.avpn.asia. So in partnering with government is one thing that we can do. The second is invest in the last mile. Inclusivity is an overused but under-practiced concept because it essentially means shifting the power balance and ensuring that previously marginalized communities now get a seat at the table and the resources to empower themselves. If we are serious in creating systemic change and building resilience, inclusivity must be a driving motivator for all our investments and decision-making processes. The third key factor is innovation. As we seek to shape a new era driven by a balance between society, economy, and ecology, we are seeing a few promising trends in the realm of innovation. There has been a rise in startups that are using technological innovations to provide unprecedented access, while investors are seeing the catalytic potential of investing in technology. Women, for example, are now conduits to future markets more than ever, as they have a statistical ability to shape household, food, and healthcare decisions. They have a unique attention to wellness and an openness to trying new products. They are also much more likely than men to search for health information online and purchase health products and services online. These characteristics could positively shape the way communities mobilize towards specific health trends while allowing an underserved population to be key market makers in a growing industry. We are also seeing innovative financial instruments emerging that can attract private capital to invest into areas that are not traditionally funded. Industry's Power Project, which is producer-owned women enterprises project, and USAID partnered with COES to support 6,800 women directly and a total of 54,500 persons in communities across bamboo value chains over 3 years. These partners saw great value in a results-based instrument, as it will have an impact across livelihoods, women empowerment, and the environment in the bamboo value chain. Farmers would receive sustainable income from the third year onwards and for up to 30 years. Bamboo planting would also help to reduce atmospheric carbon dioxide levels as well as carbon sequestration. Furthermore, bamboo does not need high quality or productive lands, and it can be grown on underutilized land as well, thus having no impact on food security. As such, a US $10 million dip with the potential to scale to $25 million was formed. This dip is going to unlock the opportunity for incubating additional producer enterprises to access global markets and capital, thereby reaching an additional 10,000 women directly and another 80,000 women indirectly. AVPN is extremely proud that both COES as well as industry are AVPN members, and USAID has been a trusted partner for a number of years. These trends reveal that the vibrant social investment ecosystem is evolving very quickly, and all of us need to learn from each other to be better equipped with best practices. That is why the South Asia Impact Capital Festival has been designed to feature members' insights, initiatives, and lessons learned across the 4 biggest areas of need in the sub-region. As Ali mentioned, we will be focusing on healthcare, livelihoods, climate action, and education. Over the next 1 month, every Tuesday and Thursday, the festival will host close to 60 discussions, deep dives, and grandstands, where 120 thought leaders and practitioners will present emerging trends, opportunities, challenges, and solutions. I want to take this opportunity to recognize our festival partners, the Bill and Melinda Gates Foundation, Sesame Workshop, the Rockefeller Foundation, the COVID Action Collaborative, VNV Advisory, the British Asian Trust, UNDP, WPP Foundation, CMS, and Satwa, all of whom have always believed in us and have once again come forward to support us in making this festival possible. I will close with this final thought. While no one would have chosen the circumstances which have brought us to this moment in history, we should look at the global crisis as an opportunity for expanding the tent, for reaching out across the silos that have separated us, and for working together with renewed purpose to create systemic change and build the tomorrow that humanity deserves. It is indeed time to smash the status quo, and we are all social investors now. I will now take the opportunity to invite a kindred spirit and fellow social investor, Dipali Khanna, to join me for the next part of this session.
Thank you, Naina. I also wanted to just give a quick brief of what the fireside chat will be about. Rockefeller has been a pioneer in the healthcare response during the pandemic, and their aspirations for a new era of partnership between public and private sectors is really bridging the global health equity divide. Naina and Dipali, over to you.
Thanks, Ali. Dipali, I'd like to begin this chat by asking you to elaborate on Rockefeller's response to the COVID-19 pandemic in Asia overall and in India particularly. As Ali mentioned, your response has been swift in meeting the needs on the ground. Can you please tell us what was effective about the Foundation's work with scaling, testing, and other prevention mitigation efforts taken, and what you think were the components that led to successful partnerships and efforts?
Thank you so much, Naina, and thanks once again for your inspiring words. We really need to be seizing the moment and really using the opportunity. So completely in sync with everything that you said. We at the Rockefeller Foundation have been actively and committedly been working in several countries across Asia, including India, by supporting local governments in mitigating the impact of COVID-19 crisis. In line with our vision, our work has been driven by promoting high-impact partnerships and sparking innovations for transformative change. In India, we've been working closely with the Office of the Principal Scientific Advisor, Government of India, and have pledged over $5.5 million to create a better tracking and management system for COVID-19 and address the needs of vulnerable communities. The Foundation has also been supporting efforts in new technologies to accelerate current and future pandemic preparedness and response capabilities around the world, as well as address systemic change to close the gaps this crisis has heightened for those in need. I mean, we all know, Naina, the kind of inequities that already existed, but with COVID-19, it's bare open in front of us. We at the Foundation have met the challenge of the COVID-19 pandemic by entering into catalytic collaborations with diverse stakeholders to achieve health equity through innovative and sustainable solutions. You again highlighted in your speech the need for collaborations. We all before COVID-19 were struggling, and we all believed that that was the route that we had to take. But I think we weren't as agile and nimble to build these collaborations. And we have seen how in the last 9 to 10 months, we've all adopted it. And that's something which has become part of all our DNA. We at the Foundation launched our public health initiative before COVID-19 with the goal of modernizing the public health systems to tackle 21st century problems by harnessing the full power of data to improve the health of populations on a global scale and to better account for factors that determine who has good health outcomes and, importantly, who does not. Better data can allow us to identify communities at a high risk for certain health issues, helping us to direct resources to where they're needed most and target preventive interventions more precisely. For example, our partner UNICEF in India is working closely with the Ministry of Health to scale its auxiliary nurse midwives or A&M online application across the country. This app, as many of you know, is called Anmol. It's helping improve data collection and health service provision by making record keeping easier. Just in the past year, about 19 states across India have adopted and implemented this tool. This is now benefiting thousands of frontline workers' ability to access digital tools and analytics, making the data they collect on a daily basis work for them rather than for others. Modernizing public health system using a data-driven approach can help achieve our global goal of health for all, not the few. Even before the pandemic, we had been focusing on early field building efforts to create a holistic and conducive ecosystem for leveraging artificial intelligence towards social and development outcomes. We partnered with the University of Chicago's social impact program called the International Innovation Core to help policymakers think through integration of AI into public health. Besides creating an AI culture and governance platform, we also created a body of knowledge and research to define a roadmap for AI integration into Health for India as well as other developing countries. We were quite humbled to say that our work was recognized by you, AVPN, as one of the top five collaborators in Asia of 2020. Now we are partnering with IIC to support the Ministry of Electronics and Information Technology for India in its AI ambitions, especially with the establishment of the National AI Center. Understanding the impact of the pandemic and leveraging regional mechanisms are critical, as you know, Nena, for the region to mitigate the social economic impact and foster recovery and resilience. We supported the Asia Foundation and the ASEAN Secretariat to conduct a rapid assessment on the impact of COVID-19 on livelihoods across ASEAN. This report provided inputs to policymakers to act effectively in shaping national and regional responses to social welfare, labor, education, and training centers for sustainable and inclusive recovery across the region. Another critical pillar of our work has been around channelizing relief efforts for the socioeconomic disruption caused by the pandemic. The reason I'm calling this as an important pillar is because this kind of on-ground work usually gets sidelined by the large systems work that large foundations do, but is still the most necessary work to be supported. I'm really proud that RF was able to work with SEVA to provide immediate relief, support, and provide information to members in real time, the majority of whom were heavily impacted within the informal economy. In India itself, between 19 to 43% of MSMEs may shut down, and the worst hit are micro entrepreneurs that contribute around 80% of employment. This could be because of really simple reasons like not being able to pay salaries, utility bills, etc. And we wanted to help them tide over this time by bridging liquidity and cash flow issues. Thus, we've been working with our partner, Global Alliance for Mass Entrepreneurship, to support a blended finance facility for India's micro entrepreneurs. We also were able to partner with Nudge Foundation's Asha Kiran, or the Hope Fund, to assess how data science and machine learning can be applied to help establish a smoother job matching process for the migrant population that was put in distress during the pandemic. Lastly, we continue to keep the lights on in remote villages for households and for businesses and the health centers, most importantly. This was all through our Smart Power program, which is now serving over 500,000 people. So, we have been extremely busy, Nena, and we've only been able to do all this work thanks to all the incredible partners that we have on the ground.
It's amazing, Dipali, as I'm hearing you say the kinds of things you've been doing. You make collaboration sound so easy, but you and I both know that, collaboration is a journey that both partners have to take with humility, with openness, and with transparency. And I wish more foundations, more resource providers would take a leaf out of your book. In fact, we've been lucky to have found the Rockefeller Foundation as a partner in our journey for a number of years. And we have tied up most recently together to launch the India Policy Leadership Lab, which I briefly mentioned earlier. And, it was actually very motivating for me and very inspirational for me to hear about all the different programs and projects that you're doing with the public sector, with different levels of government. And I believe that the India Policy Leadership Lab is the first of its kind of a fellowship, which is aimed at building the capacity of public sector officials to intentionally leverage private capital. So a question I have, Dipali, is what is it that about this India Policy Lab that excites you the most?
I think for me, working with you and, the entire team at AVPN to really give shape to this lab has been really exciting. It's really been heartwarming and inspirational to see how everybody from the government to the corporates to civil society and even individuals, especially those that have been most impacted, have all come together in the last months to really deal with the immediate blow of the pandemic and its consequent fallout. Whether we've been looking at companies or nonprofits alike, they jump to assist the government in identifying what the hotspots were, deputing volunteers for the vulnerable, elderly, persons with disabilities, the migrant population, providing shelter, setting up community kitchens. Everybody played their part. We also saw that the innovation ecosystem bolstered support like never before as parliamentarians and government extended an open call for breakthrough ideas that can really help contain the virus. We saw cheaper tests, we saw PPEs, ventilators, etc., all made possible within weeks. We started off with not really having masks, and suddenly we saw, we exporting masks. In the process, all stakeholders, whether it was civil society, markets, and government, ushered a new respect and recognition for each other's role and the value of collaboration and collective action. This was really a marked departure from the business as usual for those of us involved in the development sector, as you said. For the first time, it demonstrated that the contours of the development sector can expand beyond some social enterprises and organizations to include all actors that are key in the multi-sectoral work that is development. So this is exactly what inspired the conceptualization of this India Policy Leadership Lab, which you've curated, building on the successes of similar initiatives that you've been doing regionally. What really excited me the most is the opportunity to cultivate the next generation of policy leaders in India, where I've personally seen some breakthrough policy experimentation and innovation through the years. What had happened, however, was that market innovations and government policy innovations really forged organic partnerships. You talk to the government and they'd say, well, the private sector just pulls us in very late in the game. You talk to the private sector, they'd say, we don't know how to engage with the public sector. They're just not available. So this is, during the pandemic, we've seen all these dynamics change. So initiatives like the India Policy Labs can actually now help connect the two. It can take the policy experiments and aspirations of policymakers to private innovators and capital networks to really forge alliances for mass impact at scale. And that's what we're all looking for. So the science-driven philanthropy, that is believed in the value of breakthrough and innovations, nothing could be more satisfying.
No, absolutely. And, it's interesting. I want to ask you something. We did see most unlikely actors come together. And as you said, it wasn't collaboration or partnership wasn't limited to the usual suspects. Do you feel that this is something that was exacerbated by the kind of global crisis that none of us have ever seen in our lifetime? Or do you have faith and, do you feel positive that this kind of partnership, especially, the ones you've mentioned, the ones that you personally have been in the forefront of leading, will continue post that? And, in that, what are some of the challenges that you have felt that, you've had to tackle and learn from in this past year that will need these partnerships to continue?
So we surely faced an unprecedented challenge thinking of how we can help meet the moment when it came to the public health response to the pandemic of this scale and proliferation. None of us were really prepared for it. First, we all know it was exceptionally unparalleled, which demanded high levels of agility from our partners and us as an institution. The crisis taught us invaluable lessons. It quickly became clear that we all have to work together in a strong, effective, united, and coordinated manner. Higher levels of accountability are needed. We had to move immediately from posturing and panic to a data-driven, evidence-based approach that could safely get economies moving again. And that a strong public health system saves lives. We knew it, but we kind of ignored that reality. There was so much happening. It was also important for us to invest our high-risk capital to the most optimal ends and really identify gaps that we could bridge. We quickly pivoted to restructure our current investments and deploy new ones, whether it was India, China, US, or Africa. To that end, our efforts to accelerate the response to the COVID-19 pandemic and prevent its reemergence are focused on these areas that, taken together, will enable us to beat back the virus now, reopen the economy safely, and prevent the next pandemic. Early on, we knew that testing really held the key to controlling the pandemic. The question was about where we come in as a foundation. I think what really worked for us was to listen to people, have important conversations across platforms. And as you rightfully said, engage with unusual stakeholders to really get a nuanced understanding of the market challenges of affordable and accessible testing. At the end, we are pleased that our work on expanding India's indigenous molecular diagnostic capacities has not only secured India's capabilities in the current crisis, but also strengthened future pandemic resilience in the country. While there were just 2 domestic producers in April last year, by November, it has increased to 22, and the domestic test kit production increased from 250,000 per day to 550,000 per day. And I'm sure it's even higher than what I'm saying today, because it's just growing by the minute. It's pivotal that while making investments and mitigating the pandemic, we don't forget that we need to look beyond the pandemic as well and really think about how our interventions can strengthen health systems for the future. So that really is going to be extremely important. I hope that answers your question, Anna.
It does. And, that is where I think what I would like to say is that, I think we have sort of the pandemic, the response has made, I think, a lot of new funders, new social investors start thinking about what are they doing in terms of contributing meaningfully towards impact. What would you say are some of the areas that still require a concerted private sector capital inflow? And are there projects that the Rockefeller Foundation is looking at in the sort of near term, the next 1 to 2 years, where some of these investors who are hearing us today can think about coming in and collaborating with you?
Thanks, Dana. And of course, the crisis is ongoing, and support from multifarious stakeholders can only strengthen the response and accelerate our exit out of the pandemic. In India, we know the central government has recognized the significant value that private sector could add and engage with them to expand laboratory networks, advantage innovative technologies, and to secure diagnostic sufficiency. So I think that could be something important where the members could be playing an important role. Moving forward, what one would say is that, whether it's funders, investors, or private sector companies, to really initiate collaborative partnerships, don't try and do it alone, and really dedicate resources, both intellectually and financially, for collective and material action on accessible and affordable testing. With India advancing on its vaccination program, there's several identifiable areas where synergies with the private sector can maximize well-being to meet the pressing demands within a limited time span. The country could benefit from high-impact collaboration, and I'm going on using the word collaboration, but that's really the need of the hour, for engineering innovation, for integrating storage, logistics, and distribution capacities, deploying human capital for inoculating, managing, and tracking the program, and constructing the technology infrastructure and services for seamless implementation of the vaccination program. In addition, stakeholders can also work with the government to disseminate accurate information in order to build public confidence for the vaccines. Coming to the foundation over the next year, we're really wanting to sustain the momentum built over the course of last year by investing in innovative solutions, which are really going to be pivotal to transforming the health and lives of all people. At the foundation, we are keen on engaging with the government to support the vaccine distribution plan through meaningful consultations and mentorship, mobilization of networks, and critical financing to disrupt vicious cycles of poverty and drive towards high-level impact. We have committed to developing and funding a global health platform to help detect, prevent, and contain future pandemics. Concurrently, the foundation will continue to steer social impact collaboration and scalable systems to end energy poverty and nourish people globally through ingenuity and industry. The COVID-19 pandemic is once in a lifetime crisis that requires urgent and dramatic action. That means using all the tools at our disposal, including, for us, issuing our first ever charitable bond in 107 years of existence to help end the pandemic, and increase equitable access to care in the long term. So we've been able to get $1 billion to be supporting this work over the next 3 years through this charitable bond. So I think, we are also we're walking the talk rather than telling others what needs to be done. But as an institution, there's a very, very strong commitment right from our president down to the frontline teams.
Thanks, Dipali. I mean, I think, very, very interesting. You don't go alone. You can't solve it alone. Invest material resources on clearly identifiable outcomes. Look at innovations right from, your bond to looking at, your very bold venture to end global energy poverty, and work with government, work with other stakeholders to actually reach the most vulnerable, those who are most in need. Thank you, Dipali, for these amazing insights. And most importantly, thank you for the work that you have done, spearheading the foundation here in Asia to really guide us, lead us through this global pandemic. Thank you very much. I will now hand back to Ali.
Thank you, Naina, and thank you, Dipali. Thanks so much for kicking us off with such an inspiring session. We've now come to the end of the discussion, and we'll continue with the next session, Emerging Landscape on Gender Lens in Healthcare. It'll be starting in about 4 minutes, and you can find the link to that session right on your screen in the Hubilo platform on the right-hand side under Sessions, or you can also go back out to the agenda and select the next session. Thank you, and please enjoy the rest of the festival. We do hope you will share the highlights of the session as well on social media, and remember to tag us with the hashtag AVPN South Asia 2021 and hashtag social impact. Thanks, and we'll see you on the next session.